Annie and myself will talk about InforMS, a digital one-stop shop for people with MS to improve their health, care and health. Let me get the clicker. Okay, where did this project all start? It basically started, that clicker does not work. I'm aiming it at Rachel. This all started with a comment from a neurologist who basically said, Ingrid, that quality of life data that you are collecting about my patients, that's actually really useful for clinical care. So that sort of begs the question, can we actually give the data back to participants? At the same time, there was this challenge for neurologists. They basically lack sensitive and timely measures to measure disease progression. They give you a DMT, and then they say, okay, over a year or two, I might be able to see how well you're traveling. Maybe not quite that long, but you know, it's a long time before MRIs, the interval between MRIs is very long. It's a long period of time before they can see whether your disability has changed. Then there's the opportunity. There's some digital tools out there, apps and wearables that provide us basically with low cost but very frequent monitoring. So can we use that? And there's a shift towards consumer empowerment. I hate this clicker. Ta-da. Okay, so this then comes together with the question, can we basically have the people with MS assist in this whole process? Can they assist the neurologists? And can this data be central to their health care? So therefore, we basically came up with the idea, can we create a single digital health management system for people with MS? So, question is, what's in it for whom? People with MS. This could assist with better self-care. It could improve the shared decision-making with the healthcare team, and it would mean that all the information would be in a single location. What's in it for the health professionals? Well, they will have the background knowledge basically straight from the first appointment, and they will have readily accessible information to better tailor their care. And at the same time, they'll have more frequent data to assess whether they will better be able to assess treatment effects faster. So what's in it for the researchers? Basically, they can use the data to create prediction tools that then may assist the clinical care. And they can use the data to develop other research evidence that may benefit the MS community. And they can also basically assist with the recruitment for clinical trials. So how did we go about this process? Help me, Rachel. About deciding for the features. So we did some surveys and workshops for people with MS, for health professionals and MS societies, and they basically gave us a whole lot of information back about what they valued. So people with MS, they valued having a single health record, so that avoids telling that story, that health story over and over again. They also valued having a sort of a diary and to track that over a timeline about all their important health events they've had over the years. They valued uploading and linking other health data. If they receive information from GPs or reports from a neurologist, they'd like to stick that into that system or maybe connect to the My Health Record system. They also loved the ability to share the data with the health professionals. They liked having the visualizations and the tracking graphs so they could actually see how they were going over time. And they also like to access evidence-based information, but not just for themselves, actually also for the health professionals, because some of the health professionals didn't actually have specific expertise in MS. And some people also liked the sort of goal setting around their health behaviors. what they were concerned about was, well, maybe a system like that doesn't really help them. Maybe it wouldn't be user-friendly. Concerns about privacy, who will actually access that system. Questions around data security, and also whether there may be some data inaccuracies in that system. So we basically first developed a prototype. So that was back in 2017, 2018. So that basically allowed us to develop a proof of concept, and it also allowed us to get further funding. And that's where we are now. We have secured that bit of funding, and Annie will talk you through the development of InforMS.
Thank you, Ingrid. So I'm the project manager working on the development of InforMS. If I can get the clicker to work. No, Rach, you might need help me, thank you. So we're working with an IT provider called Healthcare Software, based off their existing app called the Snug app. We're customising that for us. And it's in collaboration with MS Australia, Monash University, Griffith University and Austin Health. And the funding is from the National Health and Medical Research Council in a partnership project grant co-funded by MS Australia. So here is where you land on the system when you first onboard onto it and have a look. It's quite busy at the moment. This is the dashboard. I'll bring you back to this in a moment once I describe the key features, but this is sort of the look and feel of what the system looks like. I'll go through each of the features down on the left-hand side very briefly in a whirlwind tour, just to describe what the key features of the system are. So moving on down to My Data. Here you can enter data answering questionnaires and surveys on information about you and your health. These are based on the Australian MS longitudinal study questionnaires, so they are very similar to those, and you can bring the data with that together. And then when you select which sections you want to fill in and click begin, then it'll pop up the survey for you. Rach, if you could, yep, thank you. And this is an example of what you might fill in to answer information about you and your MS to enter data into the system. Moving down the next section is My Notebook, and this, we're still in My Data. This is where that information that you just filled in shows you the data that you've done. This is the profile, so it gives you a snapshot of how you are now and the information that you've filled in, what it's at the moment. And then if you can move across, it also shows you how your data is over time, so you can see how things have changed over time. There's also a section in My Data called Apps and Wearables, where I just showed you the data that you entered yourself or that you can bring in from the longitudinal study, but here you can link up your apps and wearables like your Fitbit or Garmin. There's also the option to bring in a symptom tracking app that Ingrid's working on called My Symptoms for daily entry of your symptom data, and you can see all that information there as well. Now moving down to My Notebook, this is the section where you can enter notes and documents that's useful for you. So some notes you might enter are appointments, things that you've had happen like relapses, when you've gone and visited certain clinicians and that kind of thing. And then this section also links to a documents part where you can add important documents to you and link these to your notes. Then as you enter these, you can click on the timeline section and see how this data is shown across a timeline. So Rach, if you could just click the next one. Yep, there we go. So that shows how all your important notes and documents are linked across time, and you can see associations with what's happening for you. The next section, which I won't show a screen on, but it's My Goals. We're working on a section where you can create and track how you're going with goals. And then what's shown on the screen now is My Care Team. So this is a spot where you can see your current and your past healthcare providers, and they're separated by sections. And if you click on a particular healthcare provider, then you can see all the information about them, including a map of where they are, their contact information, and you can click on that contact information on a compatible device to call or email them directly from there. Next down the list is resources, and so this is managed by us as a suite of resources that we think will be helpful for people with MS. It's in sections of news, evidence-based information, invitations, and then tips about how to use this InforMS system. We curate that to be a very trustworthy source of information, scientific information that is accessible to people with MS, and it's somewhere that we hope you could go and access information that will be really helpful for you, that you can trust is backed by us and by research. And then the last section down on that left-hand panel is My Data Sources, and this is a section where you control what information comes through to the system. So highlighted at the moment is the wearable information like Fitbit and Garmin, where you can link or unlink them. There's also where you can link your longitudinal study, your My Symptoms app, which is that daily tracker one Ingrid's working on, MS Base, which is a clinical system that a lot of neurologists use, so you'll be able to link in the information from your neurologist, and My Health Record, which is the Australian government My Health Record system, so you'll be able to have a look at your information from there as well. And this is the spot where you can control what bits of information come in and what don't. Then back to the dashboard. So this is the information where it's sort of a summary of all the key bits of those features. At the top left, you can see appointments, and then next to that is other notes. So that's from your notebook, and they're the things that are coming up soon. To the right, that's got a bit of a grey background and news and tips, so that's to summarise and highlight bits of information from the resources section, and that changes each time you go see the dashboard so that you can see something fresh and new each time. The big chart down the bottom left is your data graphs, and you can choose which particular graph and which particular data visualisation you want to see in that square. And then the three down the right-hand side under the news and tips tile are My Data Entries, so that's to remind you to regularly add your information through the surveys. My Care Team, which gives you a summary of your care team providers that you've most recently entered. And then My Goals, where it gives you a bit of a summary of how you're going with your goals that you might have set in the system. Then finally, there's an important feature called a health summary. So you can click the button at the top, which has the printer icon, where you can choose which information from the system you would like to include in a PDF printout that you can use. So you can select the sections and click health summary, and then it creates a nice document for you. You can use that document to take to your clinician. You might want to print it out to have your own hard copy archiving, and it's also an accessible option if you prefer to read this information on paper. Across all these features, we have designed it so that a person with MS is in full control of their data. So that's just in response to the concerns that Ingrid discussed that people with MS said. So you can control what data is linked, what is shown, and what is shared outside of InforMS. It's accessible, so it's screen reader compatible. I also mentioned that you can print it out on paper. We make sure the text size is readable, and you can zoom in and all those kind of things. And we've made sure it's safe and secure. So we're using best practice in privacy and security, and we haven't included anything that has risky content that needs moderation, like social media. So we want it to be a safe and secure space for you to have all your MS information easily at hand. So now I'll hand you back to Ingrid, and she can talk about the next step after development of InforMS, and I'll hand you over.
So we want to make sure that InforMS is actually useful, so that's why we have a research layer over the top. So we're basically rolling InforMS out within the Australian MS longitudinal study. So if you're not part of that study, here is your chance to sign up one of the brochures, because then you can have early access. So we'll basically assess the uptake we'll see by rolling it out who's taking it up, who's not taking it up. Next one. And we'll get feedback from the people with MS and the health practitioners about which features are most useful, which features are least useful, how can we improve it, and do health professionals actually use this information as well for their clinical care. And on top of that, we'll do a longer term evaluation over 2 years to really see whether it changes the way that health professionals practice, and also whether the use of InforMS by the people with MS actually changes a little bit about their health behaviour and even their health outcomes. So all of this was done with a lot of consumer involvements. We did the early surveys, we did workshops, we have consumers as part of our steering committee, our working group, and very importantly, we have a whole bunch of people who are our product testers, where Annie basically at each phase, she will guide them through the system, she will get them to do specific tasks, and all of these people will basically talk out loud while they're doing this to see whether that's useful or whether it's difficult to find, whether everything is intuitive. So there are a couple of quotes that we had from the consumers. So some of those consumer testers. So one of the people said, the most benefit for me is to have, at a click of a button, all my MS information to see how I'm tracking. Somebody else said, I definitely would personally use these features, saves me from maintaining a record system of my own, and nice to have all this information at one place and backed up. And the last person said, good to be able to have it conveyed to a service provider, especially if you're starting with them from the very beginning. So it looks like we're starting to achieve some of those original aims that we set out. So what's our vision for the future? We basically love to improve and expand. We're hoping that we also can create some kind of health practitioner interface with a login for them and some additional features. We will adapt it based on the research feedback that we're receiving throughout the study, and then hoping to roll that out to the Australian public. And hopefully this will be able to be done at no cost. So hopefully we will be able to secure some funds to do this long term. So this project has been a real collaboration. We have some really good partners, and the major partner in this endeavour has been MS Australia. So they have provided a lot of in-kind support. They are also responsible for maintaining a lot of this information. We're working together with a great IT provider who also has an interest in this project, and this was all possible through an NHMRC partnership grant. So overall, a great initiative. We're now really reaching that tail end of the development and really going into that research phase. So hopefully you can be part of that, and happy to take any questions or see you later at the trade tables. Thank you.